Hello, magandang hapon po, and thanks for joining us. Yesterday, we talked about AstraZeneca, 5 important things to know. And today po, pag-uusapan po natin ang mga comorbidities. Ito po ang mga taong may high blood, may diabetes, nakadialysis, at iba't iba pa pong sakit na na-classify under A3, which is the vaccination priority group. Na ngayon na po, sila ay nagpapabakuna na at tinatawag na ating mga LGU. So pag-usapan po natin, what is A3? Ano po ang mga sakit na kasama po dito? Bakit? At kung ano pong dapat gawin kung kayo po ay nahuhulog sa A3. So ako po si Dr. York Bondoc. Our program is called Libreng Konsulta. Ito po ay libreng konsultasyon po tungkol sa inyo pong mga nararamdaman, ang inyo pong kalusugan. And you're welcome to join us. Please join us din po on YouTube. We are searching for 1,000 subscribers. Sana po makaabot din po kami sa watch hours na kailangan po natin para umunlad po ang ating YouTube channel. Our YouTube channel is also named Dr. York Bondoc. Pakilagay lang po sa baba, vaccination questions. Pwede naman po, kung kayo po ay high blood, diabetes, dialysis, may tanong, ilagay niyo po sa baba. COVID and non-COVID questions are also accepted and we will be glad to answer them. So tara na po, pag-usapan na po natin ang tinatawag po nating comorbidities, what we call the A3 category, at sa simpleng salita po, hypertension or high blood, diabetes at dialysis. Dapat po bang bakunahan ang mga ito? Okay, so let's go! So, nakuha po natin yung ating pong slides. We use the DOH slides para po ma-harmonize at hindi na magulo. Isa na lang ang slides and I will explain them. So, after I read the slides po, Ms. Kat, please focus na lang po sa akin as I explain further on these slides. Okay? So, Ms. Kat is focusing po and the slides that we check po are the frequently asked questions on the priority eligible group A3. Okay? Ito po ay based sa implementing guidelines for the priority group A3 and further clarification of the National Deployment and Vaccination Plan for COVID-19 vaccines. Okay, so please focus first on me. Tabi lang po muna yung slide. Or maybe half-half na lang po yung mukha namin para makita rin ako. Yeah, thank you. So ano bang, where did this come from? Okay, this, who made this priority list? Okay, the priority list was made po in cooperation po with the WHO priority listing po. So, nag-harmonize po tayo according to international standards and also po yung ating MITAG or yung ating pong DOH advisory group po ng mga infectious disease specialists and the epidemiologists po or the ones who are specializing in the pandemic, sila din po ang gumawa po nitong priority listing. So, what is A1? Sabihin nyo, bakit may A3? Ano ba yung A1? Ba't 3 ka agad, doktora? Okay, what is A1? A1 po are the senior citizens. A1 is the frontliners. Ano ba ang frontliners? These are the doctors, the nurses, and the people who are directly involved po in the care of COVID patients. So ito po, magiging these are medical personnels. And as we saw po, yes, thank you so much. The first person po na nabakunahan po na Sinovac sa Philippines was Dr. Gap Legaspi, who is the medical director po of the Philippine General Hospital. At ito po ang National COVID Hospital po ng Pilipinas. The second person was Dr. Edsel Salvania, the head po also of a big study group po, NIH, dito po sa Philippine General Hospital and the University of the Philippines, and he is an infectious disease specialist. And the number 3 person po na nabakunahan also with Sinovac was Dr. Eric Domingo. He is also from the University of the Philippines, from the PGH, and he is the head of the Food and Drug Administration. So yun po yung examples of A1 frontliners, okay? So frontliners, medical personnel that includes doctors, nurses, mga ibang medical personnel po who work first in the government facilities, followed by all their allied personnel in the government facility, including po the janitor tamanong there, and then followed po by the private naman po, and then pababa ng pababa from infirmaries, and then smaller medical centers. So nauna po talaga yung malalaking ospital ng gobyerno, followed by the private hospitals, followed by the smaller clinics, the district hospitals, the infirmaries po. Ayun po yung naging priority list ng A1 frontliners. A2 were the senior citizens with or without comorbidities. So pumapasok na po tayo now into the eligible group A3. Okay? So next, ano po? Ano nga ba A3? Ayan, A2, senior citizens, those 60 years old and above, with or without, kung meron man sakit or wala, kasama po sila sa second priority group, which is senior citizens. Okay? A3 group, tingnan po natin, I think there's a slide, who is included po sa priority eligible group na A3. Okay, ano nga ba A3? Ito po, no, let's focus para makita nyo po. Babasahin ko po, ano, and then further explanation. This group includes adults who are 18 to 59 years old with controlled comorbidities, not included in A1, frontline workers in health facilities, and A2, senior citizens. So, half-half lang po tayo. Ano ba ang A3? A3 is if you are 18 to 59 years old at meron po kayong ibang sakit. Okay, what is a comorbidity? Parati po natin ina-explain to. Ang comorbidity po means co and morbid. Yung morbid is it's a term, it's a medical term for sickness. So, ang meaning po nun is co-sickness. Meron kang sakit. So, meron kang sakit aside from possibly getting COVID. So, you have a comorbid. Okay? So, ano ba ang meaning ng, can you please write comorbidities? One of our favorite word. And one of the things po that we learned ngayon pong pandemic na to, the term comorbidities. Ayan. So, comorbidity, one sakit. Pag, halimbawa, high blood ka, so then you have a comorbidity. If you are both high blood and diabetic, so plural na po yun, meron kayong comorbidities. Kung high blood, diabetic, at naka-dialysis, so tatlo na po yung comorbidities nyo. Okay? So, yun po yun. That is what we term comorbidities. These are people who are not senior citizens. They are not doctors or frontliners, but they are age 18 to 59 years old na may ibang sakit. Okay. So ano pong meaning ng, one of the terms that we wanted to, was controlled comorbidities. So next slide po. Ito po yung mga taong, controlled comorbidities. Ito po yung mga wala daw symptoms. They are stable naman. Okay naman ho yung vital signs nila. Ano ba ang vital signs? May blood pressure na matino. Meron pong pulse rate, humihinga naman po ng maayos. Hindi po sila na-hospitalized for the last 3 months and they are out of the hospital. So, yun po yung meaning ng controlled comorbidity. Okay. So, sino po, ang daming mga sakit, Next slide po. Ang daming mga sakit. So, ano po ba yung mga comorbidities na nilista po ng ating DOH? Okay? So, babasahin ko po one by one and then himayin po natin ito later. Okay? First of all, nakalista was here on the top left, chronic respiratory diseases, followed by hypertension. Ito po yung hypertension, high blood po yan. Cardiovascular diseases, chronic kidney diseases, cerebrovascular diseases, cancer or malignancy. Number 2 na po tayo, second line na po, diabetes, obesity. Maganda po itong pag-usapan, ito pong obesity. Chronic liver disease, neurologic diseases, tuberculosis and chronic respiratory tract infections, and immunodeficiency states. Okay? So, the next slide, pakita po natin, nilista po nila lahat po ng comorbidities po ng mga tao. Okay? So, okay, focus muna po sa akin para ma-explain ko po, Excuse me. Puntahan po natin, number 1, chronic respiratory diseases. Paano mo alam, ano bang meaning ng chronic? Let me type it so that we can put it here, chronic respiratory diseases, okay? So, chronic respiratory, sandali lang po, chronic respiratory, ayan, diseases. Okay, ano po ito? What is the meaning of the word chronic? Ang meaning po ng word chronic, it is the opposite po of the word acute. Sorry, mainit po dito. So, the meaning po of chronic is matagalan. We usually term acute is something that happened now, okay, or recently. Pag umaabot na po talaga na more than months na po, hindi kayo gumagaling, yun po yung tinatawag po nating chronic respiratory diseases. What is the meaning of this? Number one, if you're asthmatic and you have been asthmatic for a long time, that is a chronic respiratory disease. Isa po yung COPD, which is chronic bronchitis and emphysema. Matagalan po yan and you're actually not gonna get better. You're just gonna be controlled. Meron po tayong, these are much rarer, yung mga interstitial lung diseases, pulmonary hypertension, basta may sakit po sa baga na matagalan. Okay? That actually includes TB. Kasi nabanggit po yung TB na separate category, but yes, TB is a chronic respiratory disease. Ita po natin cardiovascular diseases. Ano po ang mga cardiovascular diseases? At kung meron po kayo nito, you should definitely get vaccinated. The cardiovascular diseases po na nabanggit is, wait lang po, no? Ayan. Cardiovascular disease. Sakit po yan sa puso. When we see the word cardiac, yan po, the meaning of that is pertaining to the heart. When we see the word vascular, ang meaning po nito is pertaining po to our blood vessels. So it is the diseases of the great vessels which are in the heart and the other vessels po which can include small blood vessels. Okay? So ano po ba yung cardiovascular diseases? Well, number one po yung sakit sa puso. Ano? Kung meron po talaga kayong what we call mga angina, chest pain, barado po yung puso, kayo po ay na-bypass, iba-bypass, may problema sa puso, barado po ang puso, definitely you are in the A3 category. So yun po yung mga may sakit sa puso, or what we call coronary artery disease. Kung mataas din po yung inyong cholesterol, that is a disease of the blood vessels, yes. Hypercholesterol, hypertension po or high blood, kahit po nakainom ng gamot, people ask me, Doc, high blood pa ba ako kahit naka-maintenance na ako? Okay, yes, you are high blood because you are on maintenance medications. Yung atin pong mga rheumatic heart diseases, yung kabataan na tumanda na lang po with rheumatic heart, yes. Yung mga may congenital heart diseases po, they were born with this but tumanda na po and they're okay, but you still have a congenital heart disease. You should actually be vaccinated. Okay? So, yun po yung mga cardiovascular diseases. Puntahan po natin yung chronic kidney disease. One of the things you might ask is, Doktora, kailangan hubang naka-dialysis kami before we go into the A3 category? So, my answer to that is hindi naman po. Because there are chronic kidney diseases po that are still, wait lang po that are, hindi pa ho umabot sa sa dialysis, pero meron hong mga borderline dialysis cases and people who are being maintained po on antihypertensives at yung mga ganun po para hindi ho sila mahulog sa dialysis. Yes, they are still considered chronic kidney diseases. Of course, kung kayo po ay naka-dialysis, mas lalo pa kung kayo nasa chronic kidney disease. Okay? Another thing that we wanted to emphasize is cerebrovascular diseases. Ano po ang meaning nito? Cerebro, that has to be with the brain, vascular, again, blood vessels. So, cerebrovascular disease. Ayan po. Let me send it. So, ano po ito? These are people who have had strokes. These are people who have had strokes. These are people na may nagkaroon po ng bleed sa brain but recovered. These are also people who have po what we call transient, yung stroke, bleed, and what they call transient ischemic attacks, people who na nakukulangan ng dugo sa utak. So these are people with the cerebrovascular diseases. Again, please, nandito kayo sa Dapat Bakunahan. Of course, malignancy and cancer. Kung past na ho yung cancer nyo, no? People ask me, kailangan ho ba naka-chemotherapy today? Okay. normally po, if you're not on chemotherapy and okay na ho yung cancer nyo, okay na po yung cancer ninyo, like, for example, 5 years ago, you had breast cancer, wala na po talaga kayo in the A3 category, no? Because you've already recovered. But if you're undergoing cancer treatment at the moment, and you should actually be vaccinated with a clearance po from your doctor. Let's say 10 years ago, you had breast cancer. Are you A3? Actually, technically, the answer is no. But kung wala naman ho, I mean, you can talk to your doctor kung gusto niya po. But technically po, kung talagang in the super past na po yung inyong cancer, hindi na po kayo kasama sa A3. Okay? Next po, diabetes. All those on insulin, all those taking oral anti-diabetes, like mga metformin, you are diabetic po. Type 1 and type 2, and you are included in the A3 category. Ito po, magandang pag-usapan. Obesity. What's the meaning of obesity? This is measured po through the body mass index. And anything above 30 and 40 is already considered obese. So ano po ito weight over height ito Why is obesity important? Ito po, this is something na magugulat po yung mga tao. You mean yung mga sobrang taba kasama dito? Yes, I mean yung mga sobrang taba kasama po rito. Why? Because obesity po, the number 1 risk factor na mamatay po ng COVID is actually being a senior. Kaya po, tier 2 ang senior after frontliner. Pero, the second reason po that people die of COVID, especially young males, is obesity. Overweight, bata pa po at lalaki, malaki po talaga yung risk na mamatay po ito sa COVID. Okay? So this is why if your child or you yourself are below 59 and talagang malaking-malaki po yung katawan nyo, wag na po kayo mahiya. Please list yourself in the A3 category. Okay? Chronic liver disease po, that includes hepatitis, alcoholic cirrhosis, Hep A, Hep B, present not in the past. Chronic liver disease, kasama rin po doon. Of course, neurologic, i-type lang po natin si chronic liver para makita po natin. Chronic liver. Ayan po. And then let's type neurologic. So, nabanggit ko na po yung chronic liver, hepatitis, cirrhosis, may problema po sa atay. Upper GI bleeding dahil sa atay. Kailangan po kayong mabakunahan din po. Okay? So, chronic liver diseases. Okay? Ayan po. Naka-flash. Followed by neurologic diseases. Ano po ba yung mga neurologic? Well, we mentioned po epilepsy, na-discuss po natin yan. We also mentioned po yung Parkinson's, na-discuss din po natin yan. Spinal cord injuries, mga dementia, Alzheimer's, kasama po ito sa neurologic diseases. Okay? Next, yung chronic respiratory tract infection. Nabanggit na po natin ito. Usually, the most common is TB. Yung mga may immunodeficiencies po, this is not very common, yung immunodeficiencies. But kasama po dito ang HIV/AIDS. Okay? Kung may sakit po kayo sa dugo, please consult your doctor. You are included po dito. Wait lang po, immunologic. Ayan. Consult your doctor po kung meron po kayong HIV, ganun po, may sakit sa dugo, may cancer sa dugo, kulang ang dugo, iyan po yon. Actually, ang anemic hindi naman ho talaga kasama sa A3, but if it's quite serious, then you can discuss it with your doctor. And lastly po, yung Down syndrome is also included. Okay? So, inisa-isa ko ho yung mga sakit, So, any questions, ask me later. Sasabihin ko po yung sakit. You can tell me your sakit and I'll tell you if you're in A3. Okay? So, puntahan po natin the next slide. Bakit po kailangan ma-prioritize ang mga taong ito kahit sila pa po ay bata pa? Kung napansin nyo po, yung edad nila is 18 to 59, Well, because po, pag yung mga taong may sakit sa puso, may hypertension na po, may naka-dialysis, may diabetes, kung ito pong taon to ay magkaroon po ng COVID on top of his illness, talaga pong dediretso po talaga ito sa ICU. Because each of his illnesses already are already quite, lalo na pag nagpapatong-patong na ho, no? And then, ano pa po, the obese pa. So, lahat po ito, these are not good. And then you put the COVID pa po on top of it. Yung possibility po talaga na maging serious, maging ICU-able, ma-hospital ng matagalan, and possibly even dying, malaki po. Okay? So this is why na-prioritize po sila over people na walang sakit na 18 to 59 years old. Okay, next slide po. So yun po yun, slide number 4. Why do we need to prioritize persons with discontrolled comorbidities? Kasi po, baka sila mamatay pag sila po ay na-COVID. Okay? So yun po yun. Do we wait for the slide? So moving forward na po, no? Kung meron ho kayong sakit na hindi ko po binanggit, pwede ho ba kayong mabakunahan as an A3? Pwede naman po, it's possible. Depende naman po kung ano po yung comorbidity nyo. And pag-usapan nyo na lang po with your doctor. But due to kulang po yung ating pong mga bakuna, our priority po talaga ay yung nabanggit po na mga A3 categories. Okay? Next po. Sino ba ang nangangailangan? May issue ng medical clearance eh. Okay? There is an issue on medical clearance. Marami kuminsan humihingi po ng medical clearance. Okay? Sino pong kailangan na may medical clearance? First of all, kung regular high blood lang po kayo, meron kayong iniinom na gamot. Okay? Or hinihika po kayo, you are using inhaler. Or may diabetes po kayo, gumagamit po kayo ng insulina, or you are drinking po yung metformin and other anti-hypertensive drugs, no need naman po to get a medical clearance. Later on, puntahan po natin yung proof of illness. But you can just go straight naman po at meron naman hong kakausap sa inyong doktor doon. Okay? So, not everybody needs a medical clearance. Okay? Hindi po kailangan ng lahat ng tao ng isang medical clearance, lalo na kung tahimik lang po or settled or stable yung inyo pong comorbidity. For example, na-stroke kayo, natapos na ho, no? You're fine. You're just drinking the gamots para hindi po tumaas ang presyon nyo uli at magkaroon po kayo ng another bleed in the brain, pwede na hong dumiretso doon. Okay? People who need medical clearance are those with active disease. For example, yung meron pong autoimmune. Halimbawa, yung HIV nyo is active or meron po kayo lupus and you're taking medicines. Anyway, may doktor rin naman kayo. Tawagan nyo na lang. Okay? Those who are active chemotherapy, kailangan po talagang, they have to talk to their doctor. Yung mga transplant patient po, I did not mention this anong chronic kidney disease, but transplant po is included. Or ito po, pwede rin ho ito sa immunodeficiency. No? So kung kayo po ay na-transplant, may doktor naman kayo, tawagan nyo na lang. Okay? Those undergoing steroid treatments, yung matagalan na po, and those who are bedridden or hindi po makalabas ng bahay. Okay, where can you get a medical clearance? Sa mga RHU, sa mga private doctor nyo po, pwede rin po sa telemedicine. Okay. Okay, ito po yung proof of illness. Ang tanong po dito, next slide po, no? If I do not need a medical clearance, do I need any other documents? Opo, kailangan nyo talaga to. Kasi, tatanungin po nila, how do you know po na kayo po ay isang A3? No? Next slide po, from this slide na pinapakita niyo po, no? Those who don't need a medical clearance, kailangan po magkumuha po ng katibayan sa doktor. Like, this is to certify na si Juan de la Cruz meron pong asthma. And then, pipirmahan po ng doktor niyo yon. Kasi hindi naman ho sila, you know, how will they... Another reason that, another proof that you can bring po, yung rinereset, isang reseta po ng gamot. They accept that po. Reseta ng gamot na nakapangalan sa inyo, ha? Not nakapangalan sa ibang tao. Reseta ng gamot na nakapangalan po sa inyo. Next slide, please. You are showing the wrong slide or baka mabagal lang po, no? So, reseta, first of all, a letter stating na kayo po ay either may asthma, high blood, heart attack, ganun po, no? Kung ayaw nyo naman na letter, you can show the reseta with your name. Or number 3 po, you can also bring po yung gamot with your yung gamot nyo po at yung reseta. Okay? So, ano po ang mapapresent nyo as proof of comorbidity? Nandito po, no? Medical certificate from your doctor. Number 2, prescription po ng inyong gamot. Sana po nasa pangalan nyo, no? Hindi pwede sa iba. And number 3, yung hospital records. Kung halimbawa po kayo po ay na-hospital recently, kayo po ay na-opera recently, bring it here. Okay? Sa mga taong ito, no need to have a clearance. Basta malaman lang, may reseta kang hawak, you look okay, bakuna na. Okay? So ano pa ho ba? Where do you register? Sa mga LGU po, sa inyo pong, umiikot ho ngayon ng mga barangay health workers, pwede rin pong online. So, thank you so much kung kayo po ay may comorbidity. May ibang sakit. Binanggit ko na po lahat, ano? It is important for you to be vaccinated. Importante po sa inyong magpabakuna and magpalista na po kung kayo po ay tatawagin, magpabakuna na po. And this could save your life. Okay? Salamat po. So we're open na po sa mga questions and bate. Parang may questions na ata. Miss Kat, may questions na ba, Ma'am Reyna?
From Miss Leia Isais Cristobal, AstraZeneca, okay lang po ba sa umiinom ng blood thinner kung madin?
This is actually a very good question po, no? And what's brought up, and I also researched this, wala pong advisory po na, kasi iba po yung mechanism of the blood clots po caused by AstraZeneca, and iba po yung mechanism po ng blood clots that are usually po, these are people with, di ba sabi ko cardiovascular, no? Vascular. Ano ho. But, ma'am, I am sure that because you're taking Coumadin, mini-measure din naman ho yung inyong Coumadin levels, di po ba? So, go to your cardiologist po or whoever's prescribing that Coumadin and mag-usap po kayo. But again, there is no advisory that says that people who are on Coumadin cannot get AstraZeneca. Okay? But the best thing for you, ma'am, talk to your doctor also.
From Mr. Christopher Santillan, how about sa may heart history po, doktora? Pwede po ba sila magpa-vaccine? Thanks.
Yes, those people po with a history of heart attack, rheumatic heart disease, congenital heart disease, coronary artery disease, or any other problems po ng heart, it's not only, hindi lang sila pwede, the word is actually dapat. Again, kung may doctor po kayo, you can discuss it further. Pero kung controlled naman po, for example, you had a heart attack a few years back and you're controlled with medication, there is no need to require a medical clearance po.
From Ms. Corazon Malyari Castro, blessed afternoon po, doktora. Kailangan po ba ng clearance from the doctor before vaccination? Diabetic po husband ko and hypertensive. Salamat po.
Ma'am, kung controlled naman po, nakagamot lang si sir, there's no need. But you might want to bring po the reseta for the gamot sa diabetes and the gamot po sa hypertension.
From Miss Olympia Orly Musni, Doctor, diabetic po ako. Pwede po ba kami mag-asawa? Thanks po, doktora.
Diabetic po kayo. Si sir, ano yung sakit ni sir? Ito lang yes ma'am, if you are below 18 to 59 years old and you are diabetic, pwede po kayo. Kaya lang, if your husband is 18 to 59 years old pero wala naman husang sakit, he is not included in the A3 category. So he has to wait pa po.
From Mr. Maito L. Buenacosa, yes, kahit may comorbidities, pwede as long as recommended by your doctor.
Yes, wala naman pong masama na kausapin yung doktor nyo, but it is not a requirement. Lalo na po kung controlled lang naman. Halimbawa, araw-araw umiinom ka ng isang Norvas, for example, or whatever anti-hypertensive. No need na pong gumastos pa pumunta pa sa doktor. Again, kung hindi, ayaw nyo pong gumastos for the clearance, meron pong RHU or Rural Health Unit. They can give you a free medical clearance. Okay, excuse me po, adjust lang po tayo ng upuan. Thank you.
From Miss Gloria Ocampo, diabetic hypertensive po kami ng hubby ko. Pero binigyan ng clearance for vaccine ng cardio namin. Still waiting for any vaccine for senior. Pahirapan po dito sa Betis.
Ma'am, don't worry. Right now po talaga, they are prioritizing Metro Manila. And kasi po, nakalagay po dun sa atin pong prioritization list, it is okay, and it's not only okay, it's advised to prioritize po yung mga high areas po, areas of high density of COVID infections. And that is Metro Manila, NCR, and the NCR Plus. Ngayon po, truly there is a lack of vaccines pa po. The only vaccines that have arrived in the Philippines are those that were donated. Bumili na po ang Pilipinas, do not worry. But due to the surge in India at saka po yung mga first world countries na una po sa pagbibili, darating pa po yung atin. But rest assured po, darating po yun. What should you do? Hector, Reyna, I'll ask you this. Kung kayo po ay nasa A3 category, pero hindi ka pa natatawag, ano po ang dapat ninyong gawin? To keep yourself safe. Yan. You should stay at home. Okay? Kung kayo po ay A3, lalo na po kung active pa po yung inyong comorbidity, try to limit po talaga. Kasi high risk po kayo. Kung kayo po ay magkakasakit ng COVID, you really might become hospitalized po. Or worse, ma-ICU, and worse, even mamatay. So if you are in the A3 category, wag pong lilibot-libot ha. Or kung kailangan naman po talagang lumabas because you have to work, know na mas may risk po kayo and talagang strict social distancing, mask wearing, and and face shield.
From Miss Rosario Maglake, diabetic at hypertensive po ako at noong February nagpa-vaccine po ako ng anti-rabies vaccine. Pwede po ba akong magpabakuna?
Oh my gosh, nakagat pa ata si ma'am nung February. Ma'am, yes, you can get yourself vaccinated. In fact, you should because you are hypertensive po. Ano pa ba? Diabetic ba? Yes, diabetic and hypertensive. So, parang 2 comorbidities na kayo. So, go ma'am. Pwede na po.
From Mr. Raymond Alan Sese, Doktora, thank you po for the video about Astra. Nawawala fear ng mga seniors na nagpa-vaccine like my mother at magpapa-vaccine pa lang dahil sa pag-share nyo ng kaalaman nyo. God bless.
Ay naku, Sir Raymond, thank you so much for saying that. We're just really trying to educate persons po and give confidence kasi talagang ako aminin ko naman ho, hindi naman natural yung magpabakuna eh. It is normal to have worries. It is normal to have concerns. Pero ang maganda po is mag-seek out po kayo ng mga trusted sources. And ang Facebook po, kanan at kaliwa is not a trusted source. Ano po? You have to listen to the DOH, people that you know, like mga doktor po. And then, yun po yung pakinggan ninyo. And I'd like to tell you this also, si mother po, if she had a good experience and okay naman, if someone asks her, sana i-share din po niya yung kanyang experience. Ikaw, Rains, it's normal to be worried, di ba? Ikaw?
Yeah, yung buong family ko, Doktora, ako at first, aminado ako personally, nung kasagsagan last year ng usaping tungkol sa vaccine, isa ako sa mga hesitant na magpabakuna because of the fact na in scientific na lingwahe, alam natin na napakabilis ng paggawa ng bakuna. But at the end of the day, it convinced me whatever we are doing right now on our live stream. Mas marami akong naging kaalaman tungkol sa mga sakit at sa bakuna at mas nakilala ko yung COVID, no? So, ito yung nagdala sa akin at nagbigay sa akin ng lakas ng loob na, sige, game, magpapabakuna ako. Kasi, ang tumatak lang sa akin, Doktora, is, hindi yung epekto ng bakuna. Ang tumatak sa akin is, paano kung isa kami at wag naman po sana, knock on wood, kung sa amin mangyari yung mga nakikita ko at naririnig ko at naikukwento sa akin ng mga kulig ko. Wala tayong kalaban-laban. I even heard stories na cancers, ito, since we are talking about comorbidities, no? There is a story ng aking isang colleague na umiiyak siya, isa siyang nurse, umiiyak siya because she has a patient na cancer survivor, tatlong cancer ang na-survive, only to be beaten up by COVID. COVID ang kinamatay niya, doktora. Last year, she was
After
declared,
battling cancer, ano?
yes,
Oo.
tatlong cancer, doktora, and yung pinaka-last na cancer niya, that's why the whole family were celebrating last year because yung pinaka-last cancer niya, nag-relapse siya doon. After having a relapse, napagtagumpayan niya last year yung buong chemo niya and she was declared cancer-free. After a
Wow.
month, little did they know, tinamaan siya ng COVID. Ayun na.
Ayun na.
Ayun na. So sabi nila,
Ayun na.
nakakalungkot na nire-rehearse daw nung family yung kanilang last words during the cancer years, cancer journey nung nanay nila, only to find out na hindi pala daw nila yun masasabi on the last minute sa COVID kasi COVID siya namatay. Hindi nila nire-rehearse nila ha because of the cancer na meron yung nanay nila, they are rehearsing it only to not say it sa deathbed ng nanay nila because the COVID snatched it from them.
Yun
Napakalungkot na
pala.
story, di ba po? Hi!
Oo.
Ayun po, doktora.
Malungkot nga. Malungkot.
Yes po.
So, yan. Comorbidities, nakayanan, COVID, hindi. So, eto pa people ask me, do people with comorbidities die of COVID or do they die of other things? It's possible to die not of COVID, pero it's possible to die of your comorbidity also when you're in the hospital. For example, ito lang po, and of other diseases na nangyayari po sa ICU at sa ospital. Okay? For example po, mahina yung puso nyo, no? Then, naka-maintain lang kayo sa gamot, barado na po yung puso nyo, ganon. But the doctor said, as long as you continue to drink the gamot, okay lang naman, no? So, you're hanging out with a bad heart. And then, you got COVID. And because your heart is not good, you got sent to the ICU. Pwede pong bumigay yung puso nyo dun eh. Because, baseline, masama na yung puso nyo eh. Any added stress can push you towards a more serious form of your comorbidity. Okay? Second way po na pwede pong makagrabe yung COVID, not only from COVID alone. For example po, kayo po ay may COVID. Then let's say you have a chronic lung disease, nalagay po kayo sa ICU. Then somehow nag-recover ka sa COVID. Kaya lang po, the ICU is not a clean place. Meron po tinatawag po tayong hospital-acquired pneumonia. So kayo po ay tinamaan ng hospital-acquired pneumonia doon po sa ICU after having recovered from COVID. Kasi humina po yung katawan nyo, wala na kayong immunity. So pumasok na po si hospital-acquired pneumonia and that alone can kill a person. Very deadly po ang hospital-acquired pneumonia. So there are many reasons po talaga kung bakit dapat mabakunahan po yung mga comorbids because they can die from COVID alone. Yung comorbidity nila, like say bad heart, baka humigay na po yung puso nyo from the stress of fighting the COVID. And number 3 po, there are a lot of infections that can happen to a person pag sila po ay na-ICU, which are not directly related sa kanila pong sakit or even sa COVID. Okay?
From Mr. Reynaldo Segara, Abacan Jr., early stages CKD, chronic kidney
Opo,
disease.
paano nyo na lang palagay nyo na lang sa doctor nyo na may early stage chronic kidney disease po kayo.
From Ms. Rochelle Calma Alfonso, pwede po ba ang AstraZeneca sa senior?
Rochelle, is this Rachel or Rochelle?
Rochelle po, doktora.
Ma'am Rochelle, ito po yung kwento ng AstraZeneca. AstraZeneca was actually tested po on seniors. Sinovac was not tested on seniors. So, when nung March po, nung dumating yung mga bakuna po rito, AstraZeneca was the gamot that was that was allowed for seniors. So the emergency use authorization of AstraZeneca was actually for younger persons and also for seniors. Okay? Kaya lang, so talagang originally and with strong data po si AstraZeneca to be safe for seniors. Ang Sinovac po was primarily tested on people po na younger. But because 700 seniors in the Philippines got AstraZeneca and they're okay, inaprubahan na rin po ng ating FDA yung Sinovac. So currently, Sinovac and AstraZeneca are okay for seniors, but I would like to give you the further reassurance na nauna po and originally si AstraZeneca for the seniors. Okay? So yes, seniors. I would like to share also the personal, yung kapatid ho ng nanay ko is 86 years old, was vaccinated po with AstraZeneca.
Okay, from Miss Nympha Salvador, how about breastfeeding mothers po?
Ay, ma'am, si Ma'am Reyna is breastfeeding, was vaccinated po with AstraZeneca. And in the US po, a lot of breastfeeding moms have chosen po to be vaccinated. Okay naman po sila. What I would suggest po to you is to talk to your pediatrician po about your decision. And wala pong masama. It's a good decision.
From Miss Sherry Salud, need po ba clearance for vaccine from doctors?
Ma'am, as I said, and I would like to say it again kasi talagang nako-confuse po talaga dito yung mga tao. Thanks, ma'am, for asking this question, Sherry. No, you do not need a clearance from the doctor po. Lalo na po kung halimbawa maintenance lang po kayo ng high blood, maintenance po kayo ng asthma, maintenance po kayo ng mga gamot nyo po for your heart. Hindi naman ho kayo na ospital, matagal na ho, no? There's no need to be cleared, or if you had a stroke sometime back, it's okay. Kung mataba po kayo, there's also need to be cleared. But what they are asking for po is sa mga tao po na walang reseta, paano nila malalaman na kayo po ay isang asthmatic? So you have to ask your doctor to write a letter na this is to certify na si Juan de la Cruz o si Juana de la Cruz ay may asthma. Yun lang po. But it's not necessarily a clearance. It's more of an acknowledgement na may sakit po kayo. Ngayon, those who are needing clearance are those halimbawa po naka-bedridden, naka-chemotherapy. Yung talagang grabe po yung sakit, naka-transplant, ganito kahaba yung listahan ng gamot. May doktor naman po kayo. You might as well have a conversation po with that doctor. Okay?
Okay, from Miss...
Maraming confused dyan sa clearance. Kasi maraming humihingi na nagbabakuna ng clearance. It is not necessary.
From Miss Rosella Bonifacio Balingit, Doktora, ring ating hypothyroidism, okay lamo po bang pa-vaccine?
Ma'am, ang hypothyroid is not included po dito sa sa A3 category. But it's okay naman po na you can be vaccinated po for hypothyroid. If you have hypothyroid, you can get vaccinated po.
Okay, from Miss Eusebio.
Last two questions na po tayo. Kumusta yung estado ng questions natin?
Meron, madami pa pong mga questions, Doc, pero I think ito na po yung gawin nating last.
Okay, no, let's give another person pa. So,
okay,
last po, sige.
From Miss Eusebio Bondoc, yes, they must have the vaccine and they must be the priority because all these kinds of illness put them in the high risk category and they must avoid getting COVID as they will get it more severely.
Tama po yun. Si Sir is probably my cousin or my uncle. Tama po yun eh. These diseases po have been shown na pag etong mga taon to po ay tamaan po ng COVID, mas seryoso po. Kasi they are not healthy person. Kaya nga comorbid eh. Kahit bata pa po sila, may tama na po yung kanilang kalusugan. So kung kahit sila po, kasama na po yung, kaya nga comorbid eh. Pag kasama na po yung kanilang sakit at napatungan pa po ng COVID, madali lang pong maging seryoso po ang kanilang COVID, leading them to be hospitalized, leading them to the ICU, and possibly even dying. And our last question.
Our last question from Miss Carmen Isip Quito Yambao. Doktora, may allergic rhinitis po ako. Pwede po ba akong magpa-vaccine?
Yes, ma'am, you can be vaccinated. The only persons po who can't be vaccinated are those with a proven allergy po dun sa gamot. For example, grabe po yung nangyari sa inyo after you're vaccinated with your first dose. You cannot get the second dose. Kailangan po ma-evaluate kayo ng doktor. And number 2 po, if you have a known allergy po to the components of the AstraZeneca and the Sinovac vaccine, very rare po yun. Allergic rhinitis is okay.
From Mr. Raymond Allen says, borderline high cholesterol and mataas triglyceride. Pwede pa po ba?
Well, lalo na po if you are taking medication, actually, hindi naman po talaga nakalista yung high cholesterol and high triglycerides. Ano po? But again, nakalista naman po is cerebrovascular disease. And high cholesterol and triglycerides po is a cerebrovascular disease. So, lalo na po kung meron kayong iniinom na gamot, just show the reseta, pwede na po. Okay? So, sa inyo po lahat, thanks for joining us today. Our topic po was comorbidities or hypertension, high blood, diabetes, dialysis. Pwede po bang mabakunahan? Ang sagot po natin is, hindi lang po pwede, pero dapat po silang mabakunahan. Hopefully, you understood po the categories a little more clearly. Siyempre po, there will be a lot of questions. We will also touch upon this topic in a future talks po. Parati naman hong natatanong ito and we're happy to explain them. Tomorrow, we would like to invite you, maaga po tayo bukas. It's very interesting. We are joined by an infertility specialist, Dr. Irmina Gueco Mendoza. Dr. Irmina Laxina Mendoza. She's one of the most famous OB-GYN infertility specialists po dito sa Pampanga. We are happy to have her. Let me read her full name. I think I got it wrong. Dali lang po. Our topic po tomorrow is, baog po ba ako? Bakit wala pa po kaming baby? Very difficult question actually to answer. Our guest po, I have her full name here. Ayan, baog po ba kami? Bakit wala pang baby? Her name is Dr. Irmina Laxina Gomez. And siya po is a very prominent Kapampangan, an OB-gynecologist, and an infertility specialist. Her nickname is Dr. Mina, so she's Dr. Mina Laxina Gomez. She's the vice chairman po of OB-gyne at the Jose B. Lingad Memorial Medical Center, and we will be happy to have her join us po at 9 o'clock tomorrow morning. So kung may kilala po kayong gustong-gusto na pong maging mommy, pero nagkakaproblema, please invite them to join us. Thank you so much and good evening.